I'm interested in the peripheral nervous system, I should clarify. So the brain is a different kettle of fish completely. Very much on the peripheral side, and focused primarily on nociceptors, so pain neurons. And I think that this is an area that has been largely overlooked. So people are looking at nerve repair, nerve regeneration as a field unto itself. But what is often underestimated is the impact that innervation of tissues has on tissue function, but also many of the repair processes that go on within tissue. So that's really what I've been trying to explore. There have been some really nice examples in vivo, either looking at human anecdotal studies, clinical studies, or in animals. But those are predominantly looking at things like skin. And so that's mainly because skin is a really nice experimental model of regeneration, and it's accessible. But when you take a look at some of these skin models and looking at wound healing, there have been some really nice reports and really nice studies that show that the impact of innervation on wound repair really has a significant role to play. And what I'm hoping to do is then translate some of those findings and some of the basis of that into other tissues. And obviously in the body, that's a little bit more difficult to visualize and to really quantify. So that's why we're really trying to push a little bit more the use of 3D in vitro models to recreate, if not the whole organ, which would be quite a feat, but at least a tissue subsection of an organ, and look at the innervation that occurs within that tissue and the impact that might have on some of the regenerative processes that are important.